Hi, I'm Dr. Asghar Husain. There is a fundamental misconception on how people view exercise. I'll often see a trainer or a therapist working with somebody, and they scribble some exercises on a piece of paper, and they hand it to them, and then they walk away. And what I tell myself is, okay, if the key ingredient is the exercises, let's look at someone with shoulder pain. If the key ingredient is, how do I get the shoulder blade muscles to activate in a sequence that pulls everything out of each other's way? If I walk away and I don't have the training to understand how to do that, it's like someone saying, I want you to learn this dance. Here, jump up and down. Let me give you a diagram. Go do it. Good luck. Goodbye. The problem with that is people don't understand what they're supposed to get out of it. It's not the exercise that is ending in the result. It is learning how to activate the muscles in sequence. It's like learning a dance, like learning how to do the tango.
So,
If you
hey,
don't know,
you
yes.
know, your story just hit me because you're mentioning the dancing and you're mentioning getting something out of it, what you get out of it.
Yep.
It reminds me of this woman I dated, like, I don't know, it was like 20 years ago. I dated her for a short period of time. And she wanted me to take salsa dancing lessons with her. So this is the dance reference. I'm like, salsa dancing? I hate salsa.
What does this have to do with the...
But hold on. But so, but I did it, because we just started dating. So I went once, and in the middle of this, I'm looking at her and I'm thinking, why am I doing this? What am I getting out of this? Exactly what you said. What am I getting out of this? And I realized nothing. And then we didn't date after that. You know what I'm saying?
If you don't know how to do it, things are going to get pinched. And when they get pinched, then what happens is people go through weeks and months of training and they don't have the result that they need. So the answer to this is, when you see a therapist or a trainer, what you want to find out is, what am I trying to get out of this? And when they show you that, then what you need to do is to get some feedback, because the feedback is what is critical here. It's the feedback from someone whose eyes are on you, who is not you. So they may be standing on the side, they may be standing from the back. When it comes to the shoulder, we very often focus on, what are the shoulder blade muscles doing? I can't see what my shoulder blade muscles are doing, but someone behind me can even take a video, and then you can ask, show me what I'm doing right, show me what I'm doing wrong, what do I need to do differently, am I doing that? That changes the frame of this to one where you're thinking, how can I get better each visit? And not, hey, why am I not better after 6 weeks?
Okay,
Yes.
I get what you're saying, and what you're saying makes sense. But how realistic is it that you go to a physical therapist, let's say, right? And then he just gives you some exercises and hands you a pamphlet and says, here's what you got to do, and doesn't make you sit there and do it in front of him and give you feedback and tell you how to do it properly and all that. Because is that common? Is that really a common thing where they just hand you some exercises and go, okay, have at it?
It's very common, and that's kind of why I'm pushing back. And it's unfortunate, but I bring this up because there are more and more therapists all the time that have personally told me, we will not take insurance because we can't give people the time that we think that we need.
But how much time does it really take for them to, it's one thing to hand someone a pamphlet and say, okay, see ya. And it's another thing to just sit there for maybe, I don't know, like 10, 15 minutes, watch them go through the things, make sure they're doing it properly, they have the right form.
I think that there are a lot of good therapists out there, but like anything, I think there are people who care and there are people who don't.
Right. So how common do you really think this is? Like, how big of a problem?
I see these complaints a lot.
Really?
Because a lot of people will go through a rehab program, and ultimately when I see them back again, the skill I want them to work on, let's say I want them to improve the way they use their trunk muscles to have better single leg control, they will often come back and say, look, I went through 20 visits, 30 visits, and they haven't achieved anything. So to me, I think I may even say it in the video, it's like if I tell you I've taken 100 guitar lessons and you hand me a guitar and I can't play, what's the problem? It wouldn't make any sense for me to say, well, guitar lessons don't work. It would be like saying education doesn't work. That is really the gist of what I'm saying is education means the teacher, coach, trainer, therapist has to be paying attention to the patient, student. There has to be, of course, interest and enthusiasm and the right inquisitiveness. But the person who is coaching them, the therapist, they need to pay attention and see is the patient getting what they're supposed to get out of this?
Right,
Are they
but
actually
on the
improving?
on the minimal though, at least the minimal level, he or she should be watching you do the exercises, making sure that you're using the right form,
Yes.
making sure you understand
Yes.
the number of repetitions you're supposed to do, how often, and watching your form, right? That's the
Yes.
minimal.
Yes.
Okay, so don't you think at some point, it's the patient's responsibility also, if they just go in and they hand them a pamphlet, say, hey, why don't you, I don't know how to do this. Can you at least show me how to do this right?
Yes.
Okay, and that's perfectly okay for a patient to say that.
Yes.
So patients have to be a little bit more assertive in that sense too, right?
Yes. And look, in defense of physical therapists, modern medicine doesn't make it easy for a physical therapist to spend a lot of time with patients. I get that. But at the same time, we need to do something with what we have. And so, yes, I need patients to be inquisitive. They need to take ownership. And they need to say, look, my role is to learn these things and to try to get a little bit better in each visit. And the therapist's role is to pay attention and to look and see, is the person learning the things that they need to learn? Are they giving them the right feedback for the person? Because there are many people who have a hard time. The humbling nature of these kind of skills that I've seen over years of practice is that if I tell someone to contract a muscle, that doesn't necessarily mean they're going to do it. Sometimes it takes a little bit of time, especially if they haven't really done any sort of training before. So often the people who've had a long history of athletic participation, they can pick up these things a lot easier because it's in their software. Whereas someone who maybe has never exercised, if I start talking about contracting certain muscles, most people will have no idea what we're talking about. And I would say the therapist's role is to help them to see it.
Right.
Because it's not possible that they can't do it. It's more likely someone's going to skip over it.
Yeah, because the whole point of therapy is you have to do these exercises correctly.
That's right. And you have to understand what you're doing it for.
Right. Okay, let's move on.
When it comes to the lower body, it very often has to do with the posterior chain. Single leg control. When I'm on one leg, how well are my muscles holding on to me? Because if they're not, then when I'm putting my foot in the ground, I'm slamming it into the ground, I'm creating impact. And if my issue is knee pain, that is not going to improve my knee pain. So understanding how do you use the muscles, we call them the posterior chain because they're on the posterior. Yep.
Is it posterior or is it posterior?
Some say tomato, some say tomato.
So both are correct.
Correct.
Because I've been saying posterior my whole life, so now I'm wondering.
Dealer's choice.
Okay, all right, good.
They're the glute muscles, the hamstring muscles. If I say contract the hamstring and rotate the pelvis, no one may know what I just said, but ultimately you have to know how to do it because we all own these muscles. But if you don't use them, that will not be able to benefit you in the product and what you want out of a physical therapy program. So that's the point of it. The only way to really know is ask the question. Ask a therapist to help you understand, because when training programs fail, which means they don't achieve the desired result of function, I very often see it's because somewhere along the line, someone hasn't seen that a patient is not getting what they need. Now, there are situations where someone has a structural issue that needs to be addressed surgically. Yes, but there are many situations, especially when it comes to joint wearing and knee pain, when the primary issue is not addressed even after months of physical therapy because someone hasn't seen that the function of the trunk muscles is not where it needs to be. And I think one of the reasons is this. I look at movement like a language. If you are learning a new language on day 1, you will not be fluent by day 2 or by day 12 or by day 24. So the point of all of this is what you need to do is recognize this is hard. What I'm saying is very challenging. But in order to get better at it, you need to understand what you need to do and continue to get proper practice so you make progress, so you can improve your function, so you can improve ultimately your quality of life.
This is my opinion because I know how I am. With the physical therapy, there's also, you got to take into account patient laziness. Some people just don't want to do it. Even though they know it's going to help them, even though, everyone tells them it's going to help them. I've experienced this. I've had family members who have done this. They tell them over and over again, you have to do this or else, and they still don't do it. So why do you think people have that huge obstacle? Like, even though they know they have to do this, even though their mobility, their health depends on this, they still won't do it.
Yeah, I have a very big answer to that. That's way more than we can cover in a short amount of time. I think it's hard.
Yeah.
That's why I say it's really hard. There's an example that I often use is the quality of life that people want, whether it's performance or otherwise. There is one component of that which is structural. That is the things that we can measure. That is what we often spend our time, even in my world, worrying about what's your x-ray show, what's your exam show, what's your MRI show. But there's another really, really big part of that is function and biology. And what does that mean? If our body is a company, we are the CEOs. And if every organ system is an office in the company, then all of us, not just me, not just a patient, we have to ask ourselves, how are we running our companies? And we can kind of look at our lives and get some sense of where things are going. And the reality of it is whether someone is invested or not, that company is going to succeed or fail based on your choices. That's really what it boils down to. And if you make a choice to do nothing, the plane is going to crash. It's just a matter of time. It's a matter of how that's going to look like. I have no crystal ball, but it makes a lot of sense to at least try to proactively place some effort in how am I managing each of the systems that I have, whether it's my brain or my shoulders or my knees or my hips or my heart or my lung, all that stuff. If you don't pay attention to it, then it's going to eventually crash.
So take charge of your life and your health, my friend.
Yes, take charge. Today.
And I have to go now because my voice is shot and my posterior hurts.
Do it today.